Former President Joe Biden has been diagnosed with an aggressive form of prostate cancer that has now spread to his bones.
That diagnosis coming Friday after the former president reported increased urinary symptoms, which led doctors to find a nodule on his prostate. We're told that Biden is right now weighing his treatment options, and he's with his family at their home in Wilmington. Right now, joining us live to talk more about this diagnosis, Dr. Rob Danoff of Jefferson Health. Dr. Rob, thank you so much for joining us. Tell us more about this aggressive type of prostate cancer. And also, I found it interesting that typically men are not tested past the age of 70. If you can explain why that is the case as well.
Yeah, well, first of all, we do testing. It's called PSA testing. And, 1 in 8 men in their lifetime will be diagnosed with some type of prostate cancer. And it's age is the marker, right? As a person gets older, as a guy gets older, they're more likely to develop some type of cancer in the prostate. But most men do not die from cancer of the prostate. So the current screening guidelines, we usually stop screening around age 70, but this is an individual decision, because if a person is in good health, has good longevity in front of them, some of us continue to test them, and it's a shared decision what the person would want to do. Now, in terms of President Biden with his prostate cancer, they've seen that this has spread. It has spread to his bone. And so what that means is it's not curable at all. But what they're going to try to do now, it's treatable. And they're going to try to give hormone therapy, potential chemotherapy, maybe directed radiation, to try to make him comfortable, to decrease the potential spread or more cancer cells developing, and to really help him have less symptoms and feel better.
And Dr. Rob, what's your recommendation? Should men have conversations with their doctors, regarding this? I mean, this is a good public service announcement.
Jim, that's a great point, and it is an individual decision. Some men, will start at age 45 or 40, depending on if they have a family history. It's shared decision-making. What does the man want to do? But certainly we talk about it, and men should be aware of it. PSA testing is not an end-all, be-all. It doesn't mean if it's elevated, a person has prostate cancer. But we do a digital rectal exam, we check the prostate, and the PSA can guide us, and then we may do other tests, such as ultrasound of the prostate or an MRI, just to make sure that the male is okay. So, Jim, your point is very important. Guys, please speak to your doctor. Should you get PSA testing? And if you're above 70 in good health, talk to your doctor. You still may want to get PSA testing.
Dr. Rob Danoff of Jefferson Health. Thanks so much, Dr. Rob, as always, for your insights.
All right. Thanks, Dr. Rob. And of course, we'll have the latest updates on President Biden's health and treatment on air and our website, cbsphiladelphia.com.